I read this recently, this statement recently. I thought it sounded silly at first, but it makes a lot of sense. The more I thought about it, the more sense it made. And that is, it's not that people do not know, but they have not thought about it. And I think what I'm going to talk about tonight really does fall into that category. And what I want to talk about is making Cleveland Heights a child-friendly community. My concern really is that we remain competitive with our neighboring suburbs. We are in competition with them for new residents and to keep our community appealing and maintaining our quality of life. This also builds on the idea of civility that the city has created and worked on previously. So this is sort of a building block on top of that. But it really is, as I say, the idea of making our city child-friendly. From the point of view of public health, I had mentioned previously that child maltreatment data is available from the Department of Children and Family Services, but NeoCanDo at Case Western Reserve University does put it in a database form. And my husband and I generated the chart that is being passed around. I did ask before the meeting started if the cameraman could focus on this closely, but Susanna said that wasn't capable, that she did not want him to do that. So I don't know if you can see this or not, but essentially what it is a chart of child maltreatment reports that have been determined to be either indicated or substantiated, and it's the rates per 1,000 children. What we put into the chart was a comparison of, and I'll hold this up, of the following cities, or the following statistics rather. The top one being, the green one being the city of Cleveland. The second highest actually is East Cleveland, although they kind of have maintained a pretty close rate. It's probably not statistically significant, the difference between the two cities. The next line indicates the rate of child maltreatment per 1,000 children for the Cuyahoga County. And then the line under that is that of the city of Euclid. And you'll see that we kind of did a dance with the city of Euclid with the numbers. The line with the numbers is, in fact, the line for the city of Cleveland Heights, and it does have the numbers attached to it. Underneath that, so my point now in telling you this is that the cities that I'm now going to tell you about rank lower. They have a lower level of child maltreatment. And we chose these because they are our neighboring communities. So that would be Euclid, Shaker Heights, South Euclid, and University Heights. Also, the balance of the county also is lower. So what does this mean? Statistics are statistics, but they really only are meaningful if you're the person. What you experience is really only meaningful to you. So what are the numbers of these child maltreatment reports? Now, the data is only available to 2006, but in 2006 the rate was 7 per 1,000 children, and based on my calculation of what our the population of children in the city of Cleveland Heights was in 2000, that would equal approximately 84 cases. In the year 2005, that would equal 132 cases. So I won't belabor the point, but I think that the chart helps, and the data behind it helps to substantiate the fact that we as a community should address this as a public health concern. And even not to make it so dark and frowny, is that we should, I think if we move to become a child-friendly place, the quality of life for everyone will improve, just as when the ADA rules came in and the curb cuts were put in and the elevators, it made everybody's life easier. People in strollers and people who were older, and made everyone's life easier and more pleasant. So, and again, this is a focus on prevention. This does not have to do with treatment. This is an approach that has to do with prevention. And I kind of took to heart this report. It's called Preventing Child Abuse and Neglect in the United States, 6 experts' views. It was published by, it's a working paper from the RAND Corporation, but it was prepared with the support of the Doris Duke Charitable Foundation. And they asked 6 experts, if you had $5 million to spend each year for the next 5 years to prevent child abuse and neglect in the United States, how would you spend it? And they came up with really interesting ideas. Again, all having to do with a public health approach, a prevention approach, not a treatment approach. I had mentioned this previously at council, but I come a little more prepared today. I think that we would be able to implement this kind of an idea. I don't know what form it would take or should take, but we could implement this so easily and powerfully in our community because we have all the elements. We have a large number of agencies in our community already that are getting funding. There are many agencies in the community that are dedicated to treating and preventing. As I say, when we talk about preventing child maltreatment. They're all in place. They may or may not be working in concert, but they are in place and the monies are there. We also have the second element, which we have universities and the expertise available in those universities. We have 2 schools of social work and many other schools that address education, nursing. And it's a very much an interconnected, interdisciplinary concern. A faculty person from Cleveland State already volunteered. I talked with Mark about this, and he was interested. He was going to pass it on to Nancy. We have an expert, Lisa Workman Crenshaw, volunteered. She's a faculty person in the School of Social Work. She volunteered to come and talk to our community. And we are also, we're primarily able to meet this challenge and as I say, address this issue that we all know about, but we just maybe quit thinking about because of the resources we have in this community. There are a huge number of professionals who live in Cleveland Heights. They have either served in some kind of capacity having to do with human services. Those that haven't worked directly with human services, many of them are on boards or have some kind of a volunteer or some kind of emotional connection with the topic. So we have huge talents and energies, and we have the value system in place in our community, I think, to move this forward. And I would hope that particularly, maybe they get leaned on too much, but those who have retired, who are human service professionals who spend a lot of their lives sort of dealing with the treatment, I think many of them would be excited at the idea of actually doing prevention. Most human service professionals I know get very excited about prevention instead of dealing with the aftermath. And I mentioned before, there really is an aftermath. It does have implications for what goes on in schools and what goes on also with some criminal behavior, delinquent behavior. We also have all kinds of other resources available. Like we have the Heights Arts community. They could be, I'm sure, involved, or probably may even come forward to do something with public art to raise consciousness that we're a child-friendly city. The churches, of course, would be a natural connector. And one thing, and then I will stop. I don't want to take up too much time, but in the city of Pittsburgh, and this is mentioned it's mentioned in the RAND report. They came up with a program called One Kind Word. The Family Resources Agency there, in cooperation with Family Communications, which is the Mr. Rogers. Everybody loves Mr. Rogers, right? He looks at the camera. I used to look at the camera and tell people, mothers and children out there struggling, and remember, people can love you exactly the way you are. But the Mr. Rogers Family Communication, they also worked with Giant Eagle, and they came up with a series of videotapes. It's called One Kind Word, and the videotapes were produced, and they were able to take them into Giant Eagle and show them to the employees there to help them intervene in the situation which we've all seen in the grocery store, right? Kids have a meltdown. Anybody with a kid, that's where your kid, they either have a meltdown in Toys R Us, which doesn't even exist anymore, or the toy section, or in the grocery store. And so this is just one idea, and that's what they did in Pittsburgh, and I thought it was intriguing. So